I'm often asked with EFT tapping, does it matter what side of the body I tap on, and can I tap with both hands? So traditionally in all the research trials, of course, we tap on one side of the body, and all of the research to date shows that that's effective. That actually gets the outcomes of what we report and certainly lasts over time. The answer to the question, though, is you can absolutely use both hands. So if you want to use both hands, because there are those acupressure points on both sides of the body, you can absolutely feel free to do that. Of course, there's other tapping points that exist outside of the clinical EFT recipe that we test in trials. Some of them that you might like to include the one directly underneath the midline down from the breast area. So there is a pressure point there that often other people use. There's another one on the inside of the wrist, of course, that can be used. And the fingernail point, so on the each side of the fingernails, of course, you can either squeeze or tap on those. Of course, there's other pressure points like the gamut point that is down here in between those, the ring finger and the pinky, and of course you can tap there too. So there's lots of other acupressure points that do exist. Many other hybrids of the traditional EFT recipe use those. We don't test necessarily those in research purely because we're trying to increase the acceptance of the basic recipe, clinical EFT if you like, just using the 8 traditional points. And we do know the research outcomes show they actually work and are sufficient. But if for whatever reason you feel better by tapping on both sides, using both hands, absolutely feel free to do that.